Vaginal itching during a period. Main causes. Sometimes a person may experience an itchy vagina during their period. The medical term for vaginal itching is vaginal pruritus. Vaginal itching during a period can occur as a result of normal hormonal changes during menstruation. It may also signal a sensitivity or allergy to sanitary pads, tampons, or other hygiene products a person may use during their period. Causes during a period. Two common causes of vaginal itching during a period are hormonal changes and sensitivities or allergies to products such as tampons. Hormonal changes. The vagina contains a delicate balance of different bacteria and yeasts. Changes in hormones can lead to changes in the relative levels of these microorganisms in the vagina. This can lead to vaginal itching. Hormonal changes can occur for a number of reasons, including menstruation, pregnancy, menopause. Sensitivities and allergies. Vaginal itching can occur as a result of sensitivities or allergies to products that come into contact with the skin around the vagina. Some hygiene products that could cause vaginal itching during a period include sanitary pads, tampons, soaps and deodorizing sprays. Other products that could cause vaginal itching more generally include underwear made from synthetic fibers, underwear washed in harsh laundry detergents or fabric softeners, lubricants, latex condoms, spermicides. Vaginal itching may become worse with repeated exposure to a product that causes sensitivity or irritation. Other causes. The following conditions can cause vaginal itching at any stage of the menstrual cycle, including during menstruation. Vaginal yeast infections. A vaginal yeast infection is a type of fungal infection caused by the yeast candida. This yeast usually lives harmlessly inside the vagina. However, certain factors can cause the yeast to multiply excessively. These factors include pregnancy, uncontrolled diabetes, certain medications. A vaginal yeast infection may cause the following symptoms: itching and irritation around the vagina, soreness or stinging during urination or sexual intercourse, white vaginal discharge that has the consistency of cottage cheese. Bacterial vaginosis. Bacterial vaginosis is an infection that occurs when there is an imbalance of good and bad bacteria in the vagina. People with bacterial vaginosis may experience vaginal itching and a gray or white vaginal discharge that has a fishy odor. Bacterial vaginosis is the most common vaginal infection among women aged 15 to 44, according to the National Institutes of Health. Also, according to the Office on Women's Health, it is twice as common among African American women than it is among white women. Trichomoniasis. Trichomoniasis is a sexually transmitted infection caused by the parasite Trichomonas vaginalis. Experts estimate that trichomoniasis accounts for around 15 to 20% of vaginitis cases. Vaginitis is the medical term for inflammation and irritation of the vagina. Around 70% of people who have trichomoniasis do not experience any symptoms. However, if symptoms do occur, they may include genital itching, burning or soreness, redness or other discoloration around the genitals, discomfort when urinating, an increased volume of genital discharge, vaginal discharge that has a fishy odor. Dermatitis. Dermatitis is the medical term for a group of conditions that cause inflammation of the skin. One 2014 review notes that around half of all cases of chronic vulvovaginal itching are due to Allergic or irritant contacts dermatitis. These types of dermatitis can occur as a result of poor hygiene or exposure to harsh chemicals and other irritants. Psoriasis. Psoriasis is an autoimmune condition that causes skin cells to divide and multiply at a rapid rate. These cells then build up on the skin, resulting in patches of irritation. Psoriasis can develop anywhere on the body, including on the vulva and inside the vagina. There are two main types of psoriasis that can affect the genitals: plaque psoriasis and inverted psoriasis. Plaque psoriasis is characterized by patches of red, crusty or flaky skin covered with silvery scales. The patches can be itchy or sore. Inverse psoriasis typically develops in the folds of the skin. The affected skin may appear red, smooth and tight. Lichen sclerosus. Lichen sclerosus is an inflammatory skin condition that causes itchy white patches on the genitals or anus. It can affect people of all ages, but it is most common among females over the age of 50. Doctors do yet not know what causes lichen sclerosus. However, topical steroid creams can usually help alleviate itching and other symptoms. Lichen planus. Lichen planus is an autoimmune condition in which inflammatory cells attack a protein within the skin and mucous membranes. The condition affects moist areas of the body, such as the mouth, the vagina, the area around the vulva. People with lichen planus of the vulva may experience the following symptoms: an itchy rash, a pattern of lacy white streaks, painful and persistent ulcers, scarring, yellow or blood stained vaginal discharge, painful intercourse. Atrophic vulvovaginitis. Atrophic vulvovaginitis is a condition in which the vaginal tissues become dry, tender and easily inflamed. The condition develops as a result of low estrogen levels and it is common among postmenopausal females. Some potential symptoms of atrophic vulvovaginitis include vulvar or vaginal itching, vulvar or vaginal dryness, vaginal burning, spotting, pain during sex, skin splitting at the entrance of the vagina. Cancer. Vaginal itching can also be a symptom of the following gynecologic cancers: vaginal cancer, vulvar cancer, cervical cancer. If cancer is the cause of vaginal itching, the itch is unlikely to go away after a person's period has ended. Medications. Extensive use of the following medications can also lead to vaginal itching in some cases: antibiotics, steroids, immune suppressing drugs. Home remedies. Certain home remedies can help treat and prevent vaginal itching. These remedies aim to limit sources of irritation, reduce excess moisture and associated fungal growth, maintain an optimal balance of microorganisms inside the vagina. Some specific home remedies include not douching, as douching can cause an imbalance in the amount of good and bad bacteria in the vagina. Taking probiotic supplements to help restore levels of good bacteria in the vagina. Wearing cotton underwear, which is less likely to trap moisture against the skin. Not using soaps that contain perfumes and other irritants. Using fragrance-free laundry detergent and avoiding the use of fabric softeners. Bathing in warm water as opposed to hot water to avoid irritating the sensitive skin around the vagina. Soaking in a lukewarm bath with 4 to 5 tablespoons of baking soda to help soothe vaginal itching. To see a doctor. Often, vaginal itching during a period will clear up on its own within a few days. If there is no improvement after a couple of weeks, however, a person may wish to see their doctor. A person should also see their doctor if they have any of the following: A repeated bouts of vaginal itching, vaginal discharge that has a foul smell or an unusual color or consistency, sores or inflamed skin around the vagina or vulva, a pre-existing health condition such as diabetes. Pregnant women should see their doctor about vaginal itching or any other vaginal symptoms that they experience during pregnancy.